In this month's Practice Up, I get to interview the author of a provocative paper called Vitamin D, the Infection Connection. And in this interview, that author suggests that low vitamin D has nothing to do with lack of sunlight, but something else entirely, and the treatment for that is fascinating. But not only that, she says that none of us should even be bothering taking vitamin D in the first place. All that and so much more in this month's very interesting Practice Up. So you said that people don't have low vitamin D. And I know you already addressed this in your paper, and I've looked into this a lot myself, but what then, if you want to be kind of contentious, what do you think is an adequate vitamin D level, and based on what information?
Well, if the people who measure low in 25 hydroxy vitamin D also have the active metabolite measured, the 125 dihydroxy vitamin D, that's usually in the normal range or often very elevated because it's the precursor, the 25 hydroxy, has been depleted by the active form being generated in the tissues, unregulated. So it's a difficult issue because the more sensitive assay is difficult to measure, and I guess that's one excuse. But my feeling is that why not measure it? Most of the excuses that are the most common excuse used is that it fluctuates so rapidly. Yes, it does. But if your 125 dihydroxy vitamin D is found to be elevated with your 25 hydroxy low, that's proof positive that you've got dysregulated vitamin D metabolism going on. You're not deficient in vitamin D if the active hormone is high, and you don't need supplementation. To do so is just to sort of add fuel to the fire and allow the dysregulated metabolism to continue, and the intracellular bacteria that we believe are the means, the trigger for the inflammation, that's going to persist.
Yeah, and we don't need to talk about this here. I have questioned myself in the presence of both the 25 and 125 on a lab. Mm-hmm. If the 125 is high and you give supplemental vitamin D, does that border on medical legal issues? Because if you don't measure the 125, you are unknowingly contributing to a problem. But then the question is why are people not running it? And I've heard the fluctuation thing too, but I've been running 25 and 125 simultaneously. Mm-hmm. Never one by itself. And I can't tell you how many times the 125 comes back. Well, and we can talk about this within the laboratory range, so not elevated.
But that laboratory range has been artificially inflated.
Well, that's what I wanted to talk to you about. So I just had a guy with Lyme a couple of weeks ago. His 125 was 65, uh-huh, which is within the laboratory range. But in your paper and elsewhere, what is the optimal range for you for 125? I know that it's quite a bit less.
Well, I think the only study we have is a coincidental study where they were in Sweden, where they're studying something about smoking. And they had a healthy cohort, a large cohort of healthy people that they tested. And it was in the mean was, I think, 37 picograms per milliliter. They have, I think the powers that be, whoever sets these normal lab ranges, have just simply raised the range as it's gone up. So they're testing everybody who comes to the lab, and right, the ones who are tested for 125 dihydroxy vitamin D are sick.
Yep.
They don't recognize that this is not a normal population, and so they raise the range of normal when that isn't normal. It's a little frustrating. Well, that endocrinologists don't recognize this.
It's exquisitely frustrating. I have spent one of my sort of passions is blood chemistry, and taking a look at how they come up with their lab ranges in the first place. Mm-hmm. And knowing that if they're taking people that are going to the doctor that are either sick and or on medications, how is that a healthy population to be basing the laboratory reference ranges off of? And like you said, with 125, The only people ever running it are because there's something significantly pathologically going on. Listen, after we're done with this call, I'll send you a study that I came across. It was looking at 125 and sepsis, and
Okay.
they were trying to determine why 125 becomes so low in septic patients. But the incidental finding that you had mentioned, it was only 20 people, but they took 20 healthy people and they looked at their 125. And what you'll find fascinating is, I even wrote it down here. Theirs was between 30 and 35 when you took those 20 people, which is right with what you found from that 1999 Swedish smoker study. So I think it's only a cohort of 20, but that would suggest that in healthy individuals, 125 should be really no more than 35, 40 picograms per milliliter. I'll send that to you afterwards. It's small, but I thought that was significant because it correlated with that paper you just mentioned.
Great, I'd love to have that.
So in looking for normals,